All right, as this international conference continues in Rio de Janeiro in Brazil, so global leaders are debating sustainable funding prevention as also new HIV technologies, while South Africa is highlighting its response then to one of the world's highest HIV burdens, especially when it comes to the rollout of Lenacapavir. Let's give you a sense of how some of the numbers are looking. In fact, especially when you think about the global significance of HIV prevention, this particular conference is putting a spotlight on that. You're sitting at around, especially when you look at new infections, around 1.2 million, 570,000 people died and around 40.9 million people living with HIV as far as the global picture is concerned. And then also you then move on as we look at some of the key priority populations for Lenacapavir. And this is, one of the drugs that has been seen, especially when it comes to making sure that we do bring, the prevention of this particular virus under control. You think about the, in fact, the priority now, pregnant and postpartum women are among the, priority groups that the department is looking at. And if you're wondering, Lenacapavir, right, is a new twice yearly injectable ARV medicine that is offering around 96% efficacy in preventing HIV. It is the latest addition to PrEP. And also then when you look at some of the groups that are being prioritized, we're seeing sex workers as well also being prioritized. Transgender people are among those that are being prioritized as far as the work of the Department of Health is concerned. This Lenacapavir, you'd remember, much of the conversation was around the cost, and now government making sure that there are a number of people that are going to be able to access it. So it was registered for use in South Africa, you'd remember, in October 2025 with the first 37,920 doses arriving in the country. And we saw then the implementation phase, right? You're seeing around phase 1. This is from June 2026 to March 2028, around 360 public primary healthcare facilities and in 6 provinces when it comes to the burden are in fact being prioritized. And then looking at the next phase, which will then be April 2028, it's going to be looking at some of the provinces, for example, Limpopo, Northern Cape, as well as the Free State, then also coming into the fore. And then you move on quickly to see just the uptake for, this Lenacapavir per province. We're looking at a province, for example, like the Eastern Cape at around 9.1%. But one of the provinces that would have been critical would be the province of Gauteng, would be the province of KwaZulu-Natal, and you're looking at around 43% when it comes to the intake, and 27% are in a province like KwaZulu-Natal. Then we look at the Northwest and also in Mpumalanga. This is where we saw the launch of Lenacapavir. The intake there is around 9.4%. So despite these particular advances, there are serious threats, right, that remain, because as the countries gather there, you do have, for example, the United States that would have cut funding. Then it was followed by some of the European countries also raising a serious concern about what happens now, especially when it comes to HIV prevention as well as treatment, and condom use also dropping, and as well as adolescents also coming into the fore as a group of serious concerns. So we'll continue then to bring you more as far as this particular issue is concerned as this conference continues for the rest of the week.